Good afternoon, everyone. Will Dupree here in the KXAN Live studio in Austin, Texas. We're about to carry a news conference involving Governor Greg Abbott and several other officials from Texas. They're, of course, talking about the ongoing response to the COVID-19 outbreak here in Texas. We've seen hospitalizations go up and cases. Let's take a listen.
18 cases in Texas, as well as to discuss the ways that Texans can and frankly need to step up and work collaboratively to make sure that we respond to this increase. Now, from the beginning of our response to COVID-19, I have repeated several guidelines. First, decisions about how to respond to COVID-19 will be based upon data as well as advice from doctors. Second, COVID-19 remains a very fast-spreading virus that will remain in Texas, the United States, and across the entire world until treatments are available to mitigate it. As a result, we must find ways to return to our daily routines while also learning ways to coexist with COVID-19. Third, our early goal was to slow the spread of the coronavirus to prevent our hospitals from becoming overrun. We succeeded in that early goal by following the best practices to make sure that we did slow the spread. And as a result, we did prevent our hospitals from getting overrun. And as we gather today, hospitals continue to have abundant capacity to treat patients with COVID-19. Fourth, as we opened up from stay-at-home policies, we established safety protocols to minimize the increase of the spread of COVID-19. These protocols, which are contained in this booklet right here, they provide guidance for all Texans and all Texas businesses. If these guidelines are followed, they help to reduce the spread of COVID-19. The protocols have several core principles. If you are at risk or if you're sick, you should stay at home. You should frequently sanitize your hands. You should maintain safe distances from others when you do go out. And when you do go out, you should wear a face covering or a face mask. These strategies have proven to be effective in stopping the spread of COVID-19. Fifth, I've said all along that if the positivity rate or the hospitalization rate increase too much, we have strategies to reduce the spread of COVID-19 without having to return to stay-at-home policies. Sixth, closing down Texas again will always be the last option. Now, with that context, I want to review several key data points. They are shown in three graphs that I'm providing today. First is a graph showing the daily number of people testing positive. In the last half of May, Texas averaged about 1,500 positive cases a day. In the past 5 days in June, we've averaged more than 3,500 cases a day. Second is a graph showing the rise in the positivity rate. The positivity rate has gone from about 4.5% in late May to almost 9% today. Last is a graph showing the rise in hospitalizations. Hospitalizations for COVID-19 averaged just over 1,600 a day in the latter part of May. In the last 4 or 5 days, hospitalizations have averaged more than 3,200 a day. To state the obvious, COVID-19 is now spreading at an unacceptable rate in Texas, and it must be corralled. We have several strategies to reduce the spread without having to shut Texas back down. First, we need to have all Texans follow the safe protocols that we've all come to learn. Stay at home if you can. sanitize your hands, try to stay 6 feet away from others that you're not traveling with, and if you cannot stay a safe distance, wear a face mask or a face covering. Second, appropriate authorities are increasing enforcement. For example, TABC is shutting down overcrowded bars that are not in compliance. Counties are closing things like river park operations that have grown too crowded. Some authorities are requiring masks in congregated areas. Third, we are surging testing in areas that may be hotspots. We are working with the CDC on this effort. Also working with us on this effort, as well as the entirety of our strategies in responding to COVID-19, are citizens from Texas who are serving in the Texas National Guard. About 3,500 of them remain in active duty service across the state of Texas, helping our state respond to the spread of COVID-19, and I thank them for their service. Fourth, we're working with hospitals to ensure that they have the ability to treat anyone who tests positive from COVID-19. And fifth, I know that some people feel that wearing a mask is inconvenient or that it is like an infringement of freedom. But I also know that wearing a mask will help us to keep Texas open, because not taking action to slow the spread will cause COVID to spread even worse, risking people's lives and ultimately leading to the closure of more businesses. I encourage Texans to learn more about how you can get involved to help slow the spread of COVID-19, and you can do that online by going to open.texas.gov. Our goal is to keep Texans out of hospitals and to reduce the number of Texans who test positive. COVID hasn't suddenly gone away, but neither has our ability to slow the spread of it. Texans have already shown that we don't have to choose between jobs and health. We can have both. We can protect Texans' lives while also restoring their livelihoods. Together, we can keep Texans safe. Together, we will keep Texas wide open for business. Now I will turn it over to Dr. Hellerstedt.
Thank you, Governor. Please, Texas, let's heed the wise guidance that the Governor has laid out. You've heard it many times before. We are at a very crucial point in time. As you can see, that the data, the trends are going up in a way that we really need to get control of. We can get control of those by using the kind of guidance that we have laid out before. So the Governor gave a great summary of them. It's all about hygiene. If you can, in an area where face covering, that's a really great idea. It helps to stop the spread of COVID-19. We really are at a point where we need to recover what I feel was a sense of community that we had early on in the outbreak of COVID-19. We are still all in this together, Texas, and we need to act not just to protect ourselves, but to protect the entire community. So the things that we're asking you to do will be effective. We must do them now. We must curb these trends so that we can go forward. Thank you.
Thank you. Now, Dr. Zerwas.
Thank you, Governor, and thank you for your continued leadership on this. I think both the Commissioner and the Governor have spoke very eloquently about what the key things are that we need to do in order to stay safe and to really kind of rein in the spread of COVID-19. What I have spent a lot of my time on at the Governor's direction is to ensure that we have the hospital capacity to meet the increasing demand that people might have as we see the spread of the disease. We are seeing that now, and we're seeing that capacity being tested. However, we continue to have good, strong capacity within our healthcare system. You may recall we laid out a 1 through 5 level in terms of capacity, 5 being the typical capacity within the staffed number of beds, and we continue to be in that place. And we continue to see a number of patients driving the census as far as COVID goes fairly low. Now that has continued to rise. In fact, it's risen over last week since the last time I had a chance to speak on this. But it's still a minority of the patients that are in our ICUs and in our beds. And so they aren't driving the census right now, but should we not be able to accomplish what needs to be accomplished, we will see this census increase within our hospitals, and then that'll drive some additional efforts that need to be made. Those efforts are well in place. We've laid out a very, very good plan in terms of meeting what those demands are out there. One thing I would remind everybody of that the governor reminded people of not too long ago, and that was the Texas Disaster Volunteer Registry that can be found on the Department of State Health Services website. That's a place where if you're anybody that's in the healthcare field that would like to put their name in there, so in the event that we need to start drawing on volunteers for additional efforts, this is the time to do that, is to put your name in there and show where you would prefer to work and where you would be. So that's, I think, Governor, a thing that we should look at. It's not a demand right now, but it's always good to be ahead of the curve. So,
Thank you. Now Chief Nim Kidd with the Texas Division of Emergency Management.
Thank you, Governor. Just a quick update on PPE and testing. We've pushed out over 62 million masks to healthcare workers and first responders across the state. We have about 24 million in our warehouse and inventory with another 96 million en route. So for PPE shortages or concerns that are out there, we need to make sure that we're sharing those back. There is plenty of PPE in our inventory at this time. It's one of the few times you've heard me say that. The second is testing. We continue to do our 7-day rolling average is about 32,000 tests a day in Texas now. We know that number may go down, Governor, because in the Houston area we've closed all of the outdoor testing sites due to severe weather there. But testing sites remain available. There are over 840 testing sites still open in the state today.
Thank you. With that, we'll take a few questions.
Thanks, Governor. You continue to encourage people to wear masks in public, and at the same time you talk about personal freedoms. But you and I are both old enough to remember Texas where we were free to get behind the wheel of an uninsured vehicle, pop open a cold beer, leave our seatbelt off, and drive wherever we want. And then elected leaders said, wait a minute, public safety is far more important than your personal freedoms. We're going to make it mandatory that you can no longer have those freedoms. Are you even considering likening that situation with the present one?
Well, where we are in this pandemic is, if you look at the growth or even the decline in the number of people who were testing positive, as well as the positivity rate, all the way through the early part of May, Texas was moving in a very productive position. And then around the time of Memorial Day, there was an increase. And that increase has maintained for several weeks now, necessitating that next steps be taken. The best next steps are the ones that I articulated earlier with regard to different levels of enforcement, understanding this very important principle. And that is, there is a differentiation about the level of spread in different parts of the state of Texas. What may be true in Austin, Texas, is different in Austin County in the state of Texas. And we need to have latitude for that differentiation. As a result, you are seeing in some of the larger settings that have a more massive spread of COVID-19, there is an increased use of requiring masks, whereas in other areas of the state, there is no requirement of wearing masks because there is either no COVID cases or very few COVID cases. So I think maintaining a level of flexibility is important in a state the size of Texas with 254 counties, but with an emphasis, wherever possible, to make sure that the right strategies are in place to make sure that we are slowing the spread of COVID-19.
Quick follow-up.
Sure.
There's been a big increase in San Antonio. Are you surging to help the San Antonio hospitals right now? If so, how?
Sure. Just so I can make sure I understand the question, are we surging to help San Antonio hospitals? Yes. I think the best person to answer that question would be Dr. Zerwas.
Thank you, Governor, and thank you for the question. We're following all of our counties very closely in terms of what might need to be the surge requirements. All of our hospitals at this time have identified to us that they're still in a pre-surge state, which again is in that number 5 category that I've shared with you before. Different facilities will be in different levels of need out there, just depending on the census that's driving the particular type of patient. But all the areas have surge capacity plans out there, and to the extent that they need to move into other areas or they need certain things that the state should provide, the state stands ready to do that.
While awaiting the next question, to explain why Dr. Zerwas answered that question, as a reminder, among other things, Dr. Zerwas is in charge of what's called the supply chain operations for healthcare. That includes supply chain, making sure that hospitals have all the needed equipment and supplies, including personnel and beds that are needed to respond to COVID-19. Next question.
Thank you, Governor. This might be another question kind of more with either Dr. Hellerstedt or Dr. Zerwas, but we're hearing some concerns about hospital capacity both here in Austin, San Antonio, like John just mentioned, and also in Houston. We're wondering which state department, if any, is collecting hospital bed availability and hospital census numbers, and do the hospitals provide those directly, and is that provided on a daily basis?
So you were correct. I will allow either Dr. Hellerstedt or Dr. Zerwas to answer that, whichever one knows the most about it.
We may tag team this one. The hospitals do report the data in. We do not receive the data necessarily at the hospital level. We tend to have it more at an aggregated level. We do have the information on the hospitals by county, and we'll have the information from the trauma service areas. So we do keep a close eye on the number of people who are admitted that have confirmed COVID-19, both to the general, what we would call medical surgical beds, as well as to the ICUs. So we keep a very close eye on that capacity. And of course, one of the things that is possible and is done all the time in times when there's a lot of activity in hospitals and a lot of need for care is they can use that entire trauma service area as a way to fill the capacity to meet the needs of patients in those areas.
So to clarify really quick, does it go, the hospitals report to their local health departments and then the health departments report to the state, or what's the exact kind of order of how the information?
They basically come to us through the RAC system, through the regional advisory system.
Okay, thank you.
I might just also address as we start to get to a point where we realize that the census is starting to be driven more by the COVID-19 patients and concerns about bed capacity, with the Commissioner's direction and certainly with the involvement of the Governor, we host calls directly with healthcare CEOs on a regular basis, and there's no better way to have a good understanding of where they are in terms of capacity and needs than to talk to them personally. And so we'll do that on a very regular basis. I've done it here in the Austin area with people that predominantly serve this area, but have done that in each of the regions out there. And the Texas Hospital Association has frequently been helpful to try to, orchestrate some of these conference calls together. I have found that very, very helpful. And just today, I've been on the call with a couple of big CEO or big healthcare systems in the Houston area to talk about where are you, what are your needs, where do you think you're going over the next few days, what does the state need to do to line up behind you.
While awaiting the next question, let me just elaborate on that a little bit, and that is, last week I had the opportunity to speak with hospital CEOs from across the entire state of Texas, including all of the large urban areas, to get a more in-depth feel for their ability to maintain availability for anybody who tests positive for COVID-19, and I was assured and reassured consistently by all the CEOs from all regions in the entire state of Texas. They had the capability and the flexibility to ensure that anybody who tests positive with COVID-19 would have a bed available. They are professionals at maintaining hospitals and hospital bed utilization, and they know how to ratchet back on the number of people who are being admitted for non-essential surgical procedures to make sure that beds are going to be available for anybody who tests positive for COVID-19.
The the spikes that we see in the charts behind you all began around Memorial Day weekend. There's another holiday coming up where people gather and do those sort of things. What, if anything, are you doing to kind of get the word out that, this is the reason it went up, and if you don't modify your behavior, it's going to go up again, especially given, like a hospital administrator I talked to today saying he's seeing an inconsistent message from leaders at every level of government. Some say this, some say that. Some politicize the mask. It's a badge of honor not to wear one. How can you kind of overcome the resistance and bring people?
So you asked several things in that. Let me try to answer at least two of the questions I heard. One thing that I think you were talking about is we have another holiday coming up, 4th of July. And if you go back to my executive orders, it does allow gatherings for 4th of July. What it also provides, however, is it provides local flexibility with regard to setting the standards for gatherings of 500 people or more that could show up to events like 4th of July events. Already, I've seen multiple stories from multiple counties across the state of Texas that are limiting the outdoor gatherings for 4th of July celebrations, limiting or canceling parades they have historically had, as well as some other activities. I think that many of them would like to have a fireworks show, but they want to structure it in ways that minimize the potential spread of COVID-19. So the good news is we're already seeing responses from local officials. Second, we speak to local officials typically on a weekly basis. Some questions like this typically come up. And as these numbers have and continue to increase, we will increasingly let them know that the more they are doing to reduce gatherings and the size of gatherings, the more they will be able to contain the spread of COVID-19. The last thing you asked about was a level of consistency with regard to masks. And I think people could understand that if you look at these charts, it would have been one thing to talk about masks in the middle part of May when it looks like all the trends are going down. It's a different thing talking about masks today in the middle part of June with all of the numbers going up. As a result, you are seeing myself both wear a mask and talk about masks more than I did in the middle part of May. And similarly, you're seeing an increased vocalization on the local side to make sure that people are wearing masks. And there's a very important reason for that. And that's because additional scientific and medical data have shown that wearing a mask is one of the most effective ways to reduce the spread of COVID-19. And so what my urging is this, and I'll just share with you a conversation that I had with a business person in the state of Texas who wasn't all that excited about wearing a mask. This person is in the hospitality business and said that wearing a mask really doesn't fit well with the hospitality business. And as we talked through it, as the understanding began to coalesce that if we do not start wearing masks to slow the spread of COVID-19, it could result in that business actually having to close back down. And at that point in time, that business owner recognized that he embraced the utilization of masks because it ensured that he was going to be able to keep his business open. Our goal is to keep businesses open, to keep society engaged, and one of the most effective tools that we can do that is by people wearing masks. This is not going to be a permanent assignment. Hopefully it will be a temporary requirement, one that will get us to that next level when we have treatments that will respond to COVID-19.
A follow-up, if I may.
Sure.
In that resistance was the recorded conversation we heard. It was directed rather personally offensive to you on a number of levels. Do you have a message back to the people who talk like that, whether it's personal or as governor of Texas?
It reveals a lot about an organization's morals and character, that they would use vulgarity to talk about someone in a wheelchair. And I think the public should judge that organization and the positions it takes through the lens of the people who act that way.
Thank you, Governor. You're saying today you're recommending for Texans to stay at home as much as they can And back in the spring, you had announced that you were going to be expanding early voting, thinking that the curve will have flattened by the time the primary came around. But now with early voting starting next week and we're seeing these spikes, do you still think it's safe for Texans to be voting in person?
I do, for several reasons. One is I increased the length of time for early voting so that more people would have a longer period of time together for the purpose of voting, meaning that they could go into voting sites with them being less crowded. Second, as we are talking about today, it is important for people to wear masks when they go out, especially in congregated areas like a potential voting location. And so we believe that if people take the time to vote early, and when they do so, wear a mask, it really shouldn't pose much of a problem with regard to being exposed to COVID-19. Any more?
Thank you, Governor. Depending on whether Texas can flatten its curve of infection rates, could you see yourself, you said that shutting down completely is a last resort, but would you consider maybe scaling back some of your phased reopenings, or how close are we to having to do that?
Again, the important thing is to follow the data. And as we continue to monitor all of these three metrics that are on these charts behind me, we need to evaluate what is the effect of the additional wearing of masks, cracking down on places that are not following the protocols that have been established in here, making sure that everyone is following the best standards to reduce the spread of COVID-19. I believe that if these protocols are followed, if people return to the practices that we adopted a couple of months ago to slow the spread, I think we will be able to curtail this expense. That said, we remain flexible with regard to implementing additional strategies, if needed, to make sure that we do contain the coronavirus. Let me emphasize this, and that is, looking back at these charts, the way that hospitalizations are spiking, the way that daily new cases are spiking, surely the public can understand that if those spikes continue, additional measures are going to be necessary to make sure that we maintain the health and safety of the people of the state of Texas. There's been in each of these three categories, there's been pretty much a doubling of the numbers in those three categories. If we were to experience another doubling of those numbers over the next month, that would mean that we are in an urgent situation where tougher actions will be required to make sure that we do contain the spread of COVID-19.
Will Dupree, once again here in Austin. We've reached the conclusion of this news conference involving Governor Greg Abbott, Chief NIM Kid at the Texas Division of Emergency Management, Dr. John Hellerstedt, the Commissioner for the Texas Department of State Health Services, and Dr. John Zerwas, who works for the University of Texas and also serves on the supply chain strike force convened by the governor there. Some disturbing things that the governor wanted to talk about today was the increase in the number of COVID-19 cases here in the state somewhat recently. Not only a spike in the number of cases confirmed, but also in hospitalizations, and deaths have risen as well. The numbers that he pointed out, and he was comparing what had happened in May when the trend had been going down compared to what it was just last week, and there is a big difference in that. So first of all, in the number of positive cases confirmed by the state, back in May, there were about 1,500 positive cases per day. In the last 5 days, he said it's now 3,500 cases per day, which is a big, huge increase. When it comes to the positivity rate, so this is how many tests are coming back positive for people going to get tested for COVID-19. Back in May, it was 4.5%. And now today it's almost 9%, a doubling there. Regarding hospitalizations, he said right now it's about 3,200 people are being hospitalized per day within the last week. again, another jump there. So what he is saying is that this is really directing all of us to be a lot more cautious and to follow these certain safety guidelines, whether it's personal hygiene, improving that, keeping that physical distance of at least 6 feet from people who are not within your same household, and also wearing your mask, like what I have right here. So this goes on as soon as I leave this room that I'm in at the moment, and that is a good way to not only protect yourself, but also protect others in case you yourself are infected. Cannot repeat that enough. We also were saying that here in the state of Texas, the testing capacity has gone up as well. At the moment, the state is able to offer about 32,000 tests per day. That's all across Texas. As of today, there are about 840 testing sites open, and there is more information on the state's websites if you are interested or want to find out where the closest COVID-19 testing site is near you. The governor was also asked about voting because there was an upcoming runoff election and special election coming up in July 14th, and he said he thinks it is safe to still vote in person at the moment. He did say that he lengthened the time for early voting, and he said that gives people some flexibility to be able to go to the polls, maintain some sort of distance between other people who are going to do that too, but also he said you need to wear your mask to do that. We want to point out as well that Governor Abbott is allowing counties, rather, I should say, as I'm getting my words together. So several counties are now, and cities are saying that even though they cannot enforce a citywide mask requirement for all the residents, what they can do, and there was a caveat there, is that cities and counties can say businesses must enforce mask wearing for both customers and employees, and a number of places have taken that step, including in Bexar County, Travis County, Hays County. Some of the more populous areas, including Harris County, are taking that measure because they are seeing these increases going up. For those of you who are unaware where the numbers stand at this point in the state, I want to show you all this full screen really quickly. So we have crossed 100,000 cases of COVID-19 here in Texas, 111,601 cases as of this afternoon. These are numbers, again, reported by the Texas Department of State Health Services. We now have more than 2,000 people dead from COVID-19 in Texas. 1.7 million people have been tested for the virus so far. Right now, there are more than 40,000 active cases, closing in on 41,000, may reach that mark by later today as more numbers are shared. 3,400 people are currently in the hospital fighting COVID-19, and we are heartened to see that at least 68,000 more now have recovered after receiving a positive diagnosis. The governor was also asked there, the last question to him was, would he consider rolling back some of the reopenings as a part of his plan if the numbers keep trending the way that they are? And he would not answer directly on that. He did kind of hint and say that the state will remain flexible. That was his word on implementing additional strategies to prevent further spikes here in the state. But he really put the onus back on all of us who live here in Texas, saying it is up to you to really follow these guidelines and listen to what they're saying. Seeing these cases go up, seeing the hospitalizations go up, seeing the death rate go up here in the state should make people pause and consider those very essential safeguards to be able to protect themselves and others and their community. So we do thank you all for watching. You can pay attention because one of our reporters for the Next Star stations here in Texas, Maggie Glenn, is going to be turning a story, wrapping up that information that you heard there. You'll see updated information on all of your local news stations' websites, so we hope that you'll tune to that and keep paying attention to this situation because this pandemic is not over. We cannot stress that enough. Thank you all again for watching. I'm Will Dupree here in Austin, and we'll see you back here another time. Please, everyone, stay safe and stay healthy.